Hi everyone and welcome to Kidstop Press. As per the WHO, around 17.5% of the adult population which is roughly about 1 in 6 people worldwide, experience infertility. And India seems to be witnessing a significant surge in IVF cases. Today, I'm looking forward to talk to an expert who will be able to answer questions any of you have on infertility and on pregnancy and things that related to that. Dr. Anjali Malpani is a pioneer in the field of IVF and reproductive treatment. She's been an IVF specialist for over 30 years, is the founder and director of Malpani Infertility Clinic in Mumbai, which is one of India's first private IVF fertility centers. She's also funded an IVF center called the MAA IVF Center, which helps provide free IVF treatment to couples who do not have the means to undergo this expensive treatment. And she's helping make sure that their families have a chance to become a family. So, welcome to Kidstop Press, Dr. Malpani.
Thank you so much, Parul. IUI is intrauterine insemination. IVF is in vitro fertilization. Both of them are assisted reproductive techniques. We use IUI when the husband's sperm count is low, when it is around, say, 10 million, 11, 12 million, if the motility is a little low. Sometimes we need IUIs when there's a sexual problem. For example, if there's ejaculatory disturbance or there's an ejaculation or erectile dysfunction where the person cannot have a erection or there's premature ejaculation or the woman has a problem. For example, she gets pain during sex, which is known as
Okay.
vaginismus. So these are the indications for IUI. In this, we spin the husband's sperm, the semen, we process it in the lab and use the best sperms and put it inside the uterus when the woman ovulates. And how do we know the woman ovulates? Is when we do a sonography. Typically, a woman ovulates around if she has a regular period, she ovulates around 12, 13, 14, 15th day. And that's when we
Okay.
watch that the egg has ruptured and then we put this inside. The success rate of IUI is about 10 to 15% only. While IVF is a totally different technique where we give injections to a woman, hormonal injections to grow a lot of eggs. We monitor her with sonographies and blood tests to see that the eggs are growing. And when the eggs are ready, we put a needle inside her using ultrasound It's called ultrasound guided vaginal egg pickup. It's done under anesthesia. Eggs are retrieved, and the eggs, and again the semen is processed in the lab and kept, and the eggs and the sperms are added in the laboratory. Then we make embryos
Yeah.
out of this. I mean, they fertilize the eggs and the sperms, and then we put in the embryos inside the uterus on day 5. There are multiple reasons. It's a couple's problem. Now, in the past or even today, everybody blames the woman because she's not getting pregnant. But it's not so. Medically, if you go to see, 40% of the time it's a woman's problem, 40% of the time it's a man's problem. It's an equal problem. 10% of the time it's a combined problem, and 10% of the
Okay.
time it's called unexplained infertility where there's no reason. So both men and women can have problems. In the women, there are multiple problems. The commonest is an ovulatory dysfunction, which means she doesn't ovulate regularly, she doesn't grow eggs. Sometimes she has a hormonal
PCOS,
problem.
PCOD.
Polycystic ovaries, you've heard of this name, and now practically everybody is diagnosed. Half the women are diagnosed as PCOD because they go to the dermatologist with a little bit of acne. The dermatologist says, "Oh my God, do a sonography," and then you go to a gynac, and it's such a chain of events, and everybody's PCO today. But that every all PCOs are not infertile. Let me tell you that. Sometimes the fallopian tubes have a problem. The fallopian tubes could be blocked because of some infection. In the past, we used to get infections, severe infections, because, like, for example, there was TB in the past. Today, we don't have many TB patients. There are infections which cause what is called PID, pelvic inflammatory disease, where both the tubes and ovaries get stuck to each other. We don't see much of that today.
Yeah.
In the past, we had sexually transmitted disease. Again, we don't see. So these tubal problems are less.
Yeah.
But there's also something called endometriosis, which means some of the blood comes down through the vagina and some of the blood regurgitates back through the fallopian tubes. and sits on the ovaries. Sometimes there are cysts, big cysts in the ovaries, and that causes problems. And the other thing is sometimes there are problems in the uterus, such as polyps inside the lining of the uterus, called polyps or submucosal fibroids. Now, again, I want to say that half the women have fibroids. That does not mean that causes infertility. This is very, very important because see, if you don't know, then I'm sorry to say, but a lot of doctors take patients for ride and they say, oh, you've got this tiny little fibroid, let's remove it and you'll get pregnant. But 90% of the time, you don't require anything because the fibroids are in the muscle of the uterus, called intramural, or they're
Oh,
outside the uterus. They don't need to be taken out. The only ones which require to be taken out are
okay.
inside the uterus, called submucosal fibroids. So these are the women's causes, and in men, usually what happens is the count goes down. Like I said, the WHO criteria today is 15 million per ml counts, and motility should be about 40%. So if the counts are less than 15 million, of course, it doesn't mean a 14 million. If your count is 14 million, you're infertile, but around 15 million. But if the counts are lower, then they have a problem. If the motility is lower, they have a problem. And like I said, you require IUI. We can have treatments for those. But I would like to say one more very, very important thing. There is no medicine in the world, whether it's allopathy, Ayurvedic, homeopathy, no surgery in the world can increase your motility and your count. And this is a very, very common thing which is happening. You come with a low count or low motility. The doctor doesn't do IVF. What can the doctor do? The doctor, I mean, the patient will be very unhappy if you say, oh, there is no treatment. They just give them, prescriptions over prescriptions. They give them all the vitamins in the world, vitamin K, vitamin C, CoQ, nutrients, blah, 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 all kinds of things. And the patients are actually getting fooled. So I have patients, we come with 100 reports literally hoping that their sperm count would go down. They've wasted 5, 6, 7 years of their life, which is really sad because, like I said, the woman's age has gone up.
Yeah.
By the time she's almost reaching 40, you know. So that's the problem. So please read up. My only message would be to get informed, read on the right, go to the right doctors.
Dr. Malpani, is there anything that you would like to share with our audience that you would want them to know more about?
I just one or two things. I've already said this before, but if you like, because fertility goes down after the age of 35, if you do want to get pregnant, I think you should try at least, if not in the 20s, late 20s, you should try around 30, 35. If you want to freeze your eggs, go early, freeze them. We have technology today so that you can keep them. You don't have to put them in the embryos, but you at least freeze your eggs when the quality is good. Do not go rushing when you're 40 when the egg quality is bad. The second thing I want to, most important thing is I want to tell people that please read up about your own body, about baby making, about certain things. I'm not expecting you to read a medical book, but go and visit the right sites so that you have well informed. I think what I call them as a VIP, a very well informed patient, is the best patient because then doctors don't take you for a ride. At least you have sensible questions to ask if you're not getting a baby. If the doctor tells you, you can say, hey, look, I read this somewhere, so the doctor's on their guard. Because infertility patients are very vulnerable and gullible. And the other thing is there are new advances taking place every day. Just because something is happening today, or I have learned this, or I read about this in a journal last year, doesn't mean I'm going to experiment on you and charge you a bomb. And that is what is happening. People are saying, oh, wow, this is what I'm going to do. I've got this latest scope, embryoscope, and I can increase your fertility and charge you a lakh of rupees. It's a big no no. You have to understand that technology is there, everything always doesn't work. It takes time for us to know whether something is working by randomized controlled trials, what we do. So just don't jump because you read somewhere and read the right stuff. Mr. Google is good up to a point. Dr. Google is even better sometimes if you go and combine Google and the doctors together. So please read the books and, kind of be well informed. I think that is my sincere message to most people.
Thank you so much, and congratulations on your book again.
Thank you so much, Parul. You were really good, very good questions indeed. And I was very really happy talking and, explaining a lot of stuff. Thank you.
For parenting tips, celebrity interviews, recipes, conversations with experts, DIYs, and lots more. Subscribe to Kids Talk Press now.